Here we shall discuss severe pancreatitis and try and understand the concept necrotizing pancreatitis. This video forms part of a group of videos within the playlist on acute pancreatitis. 15 to 20% of the patients with acute pancreatitis will develop severe pancreatitis. Is it possible to predict this? Yes, there are several scoring systems that utilize lab-based and physiological parameters to try and predict which patients will get severely ill with pancreatitis. Let's try and understand this. Here's a cartoon drawing, and this is an approximate location of the pancreas. When pancreas is inflamed, it produces chemicals called cytokines, and these have inflammatory effect throughout the body. And just looking at the pancreas over here and how it can affect the heart, the lungs, the kidneys, and the gastrointestinal tract. And when these organ systems are affected, they begin to fail. It is important for these patients to be identified early so that treatment may be provided for low blood pressure with artificial support. Patient may require correction of their oxygen levels by various means, including inserting a tube into the windpipe and mechanical ventilation. The kidneys may fail and temporary dialysis may be required. And finally, nutrition may be provided artificially where required. All of these are best provided in an intensive care unit where the patient can be monitored very closely. This is a dangerous condition and is associated with a risk of mortality. Let's now have a quick overview of local complications associated with severe pancreatitis and understand the term necrotizing pancreatitis. So what are the complications that may arise locally around the pancreas? Acute fluid collections are fairly common, and if they are not infected, then they do not require any treatment. If infected, they require to be drained under radiological guidance and antibiotics given. What is a pancreatic pseudocyst? A pancreatic pseudocyst is an acute fluid collection after 4 weeks, which now has got a scar tissue wall around it. It does not have a membrane and it contains liquid, and this is a pseudocyst. So here's a cartoon of the pancreas, and these blobs that you see have lost blood supply. So there are areas within the pancreas that lose blood supply are called necrotic pancreas. And when they are combined with pancreatitis, it's called necrotizing pancreatitis. The amount of pancreas that dies and loses its blood supply is variable. If a large part of the pancreas dies like this, then it is a dangerous condition. So long as necrotic pancreas is not infected, no intervention is required. However, if bacteria form within these necrotic areas, then it is a very dangerous condition called infected pancreatic necrosis. Treatment in a specialist unit is mandated, and for the great majority of the patients, mechanical debridement and removal of the dead pancreas is required. Increasingly in the modern day, this is performed through minimally invasive route. What about walled-off pancreatic necrosis? If a pseudocyst contains dead pancreatic tissue, then it's called a walled-off pancreatic necrosis. Blood vessels in the vicinity of the pancreas are attacked by activated pancreatic enzymes, making their walls weak and causing them to leak blood. Patients who develop a pseudoaneurysm are at risk of significant life-threatening bleed. Likewise, inflammation within the pancreas may cause clots to form within the portal venous system. And finally, long-term, patients are at risk of developing diabetes and pancreatic enzyme failure because of the loss of pancreatic tissue, and hence the pancreatic function is affected. This is a brief overview of severe pancreatitis. I hope you found it of use. If you have any comments, please do share.